Hi everyone, my name is Jolie and I'm a third-year microbiology, immunology, and molecular genetics major at UCLA taking PHY SCI 121. Today I want to dive into the mechanisms and therapies of language deficits and speech problems in boys with Duchenne muscular dystrophy. Duchenne muscular dystrophy, or DMD, is an X-linked severe muscle disorder that impacts young boys and affects their mobility and significantly shortens their life expectancy to about their late 20s or early 30s. DMD is distinctly characterized by the lack or absence of the protein dystrophin, which is caused by mutations in the dystrophin gene that result in a truncated or non-functional dystrophin protein production. Through interactions with the dystrophin glycoprotein complex, otherwise known as DGC, dystrophin has an essential role in serving as the link between the actin in the cytoskeleton and extracellular matrix during muscle contraction. Without functional dystrophin, the sarcolemma or plasma membrane of skeletal muscles gets damaged during contraction, which impairs skeletal muscle signaling and damages muscle cells, leading to severe muscle degeneration and weakness. The unfortunate reality is that DMD is not very well known in many communities. The initial symptoms of DMD start as early as 2 years old, but they are very overlooked and just assumed to be more common learning disabilities or behavioral problems. This causes many DMD patients to delay their diagnosis, which in turn causes delayed treatments and muscle degeneration continuing to get worse. One early overlooked symptom that precedes muscle weakness in young DMD boys are speech problems. Delays in speech have been found to begin at around 28 months and are especially common in DMD patients with mutations after exon 45 in the dystrophin gene. When DMD boys reach preschool age, many of them also display phonological difficulties in articulation and repeating long sentences. This is a figure displaying the percentage of abnormalities in several speech component results between the specific language impairment groups in orange and the DMD group in blue. There are peaks in abnormalities for articulation and sentence repetition for DMD patients. The connection to this course of identifying speech delays as an early symptom of DMD in children pertains to preventing delays in the diagnosis of DMD, which we all have seen in many of the patient cases within the lecture videos, where their symptoms are often referred to as developmental delays, behavioral problems, or intellectual disabilities, as opposed to the consideration of a muscle disorder. This video is to not only spread awareness about the DMD symptom of language deficits, but also highlight the role of the lack of dystrophin in causing these speech delays and the treatments that could be done for DMD boys with speech deficits in order to allow them to communicate with others and have their needs heard. So what is the role of DMD in causing speech delays and language deficits? In the lower part of the brain, there's a section called the cerebellum that is not only responsible for motor skills, but also for language functions like fluency while speaking and processing grammar while understanding and using language. Within the cerebellum, large amounts of dystrophin are found in the Purkinje cells, which are neurons that have many connective branches that serve as circuits controlling many functions including movement, cognition, and emotion. In MDX mice, researchers have found that the firing rate of the Purkinje cells of the cerebellum was significantly lower and more abnormally variable than the firing rate of control mice. Having disruptions in the firing rate of the Purkinje cells impairs neuron communication and results in not only motor issues in the cerebellum, but also problems with language processing and learning since these components are also managed by the cerebellum. These neurological findings in the MDX mice may provide insight into dystrophin's role in forming and maintaining synapses for neuron communication in the cerebellum. Therefore, as part of the multidisciplinary care that DMD patients receive to help them not only extend their life expectancy through treatments preventing excessive muscle damage, but also their quality of life, DMD boys with language deficits should also have speech specialists to help them improve their verbal deficits or incorporate the use of speech devices that can help them communicate easier and have their needs heard. So what are the treatments and therapies that help improve the communication of DMD patients with speech deficits and language delays? Speech-language pathologists often work with patients with muscle dystrophies, have developed treatments based on the fact that the speech muscles are very weakened in these patients. As a result, they focus less on repetitive strengthening exercises of the speech muscles and more on helping the patients slow down their speech in order to help make their verbal communication more intelligible. One technique that speech-language pathologists use is helping DMD patients with developing pacing methods, like tapping on a table to help slow down their talking speed and enunciate each syllable. This would help DMD patients' speech by helping their words sound more distinct. Another technique is incorporating an alphabet board, in which the DMD patient could point to the first letter of the word that they are trying to say. This would prevent the misinterpretations of letters that sound very similar, such as the T and the D sounds. This method is helpful for smoothing out communication hurdles because speech-language pathologists believe that understanding the first letter of each word would help listeners understand DMD patients more. Many of these speech-language pathologists also acknowledge that sometimes the speech muscles of DMD patients have weakened to the point where their verbal communication is no longer intelligible, which is when the use of augmentative and alternative communication, also known as AAC, devices are recommended for DMD patients to be able to still communicate with their listeners without having to verbally speak. These AAC devices involve tablets or laptops that can audibly say the words that DMD patients can choose, which are specifically designed and based on the needs and motor abilities of the patient in order to make these devices easy for the patients to use to communicate their thoughts. Examples of these devices could involve eye gaze technology that serve as a mouse pointer that follows the eye gazes of DMD patients when they are picking letters from a keyboard. This would allow the patient to be able to select letters to form their own words and sentences without having to use their hands in the case that their hand muscles have become entirely weakened. These AAC devices can also involve buttons with different emotions in order to allow the DMD patients to easily express their emotions, such as discomfort or happiness. The development and incorporation of these AAC devices may overall offer the DMD patient to be able to communicate their needs when their speech muscles no longer work. In conclusion, the lack of dystrophin in DMD patients causes a wide variety of motor weakness, one of the significant ones being language deficits and speech delays. Since the lack of dystrophin disrupts the signaling pathway and communication within the Purkinje cells of the cerebellum, which is a portion of the brain that has a role in language processing and fluency, speech impairments and learning issues related to language often develop in DMD patients. While this may inhibit DMD patients' forms of communication, the incorporation of speech-language pathologists as part of their multidisciplinary care is an essential component for making their speech more intelligible and offering speech technologies that ensure that DMD patients are still able to have their needs heard. In the future, muscle disorders like DMD should always be considered by healthcare providers when treating patients that present issues with language delays and speech deficits. Doing so would encourage parents to not only become more educated and aware of DMD when they see abnormalities in their children's development, but also encourage more people to consider genetic testing in order to know if they have abnormalities in their genes linked to a detrimental disorder like DMD.